I can tell you exactly at the very beginning where it started, right here in the hospital, when I took my father in to have his chemotherapy. And I was struck straight away by the team of nurses and doctors. They were superb. And I remember thinking, there's so little you can do when somebody has cancer, except raise money.
The people who work in these hospitals are amazing. They do amazing things every day. And we are here to help those people do the best job they can do by listening to their needs and how they think patients' lives could be made that little bit better, and that's our role.
After my father was diagnosed with cancer, I wanted to raise money to support Nottingham Hospital's charity. I decided to do a solo walk from London to Edinburgh, and it turned out to be the hardest thing that I have ever done. I wanted to see where and how the money that people had donated was being used, and to meet some of the people that had benefited. The first place I visited was Hayward House, which provides care for people with life-limiting illnesses.
What you see here now within Hayward would not be possible if it wasn't for the tremendously generous fundraising, donations, and everything. That's what makes Hayward special.
That says it all. Next on our visit was the Wilson Cystic Fibrosis Centre. This amazing building has received support from the charity to help create a better environment for patients whose lives are severely affected by debilitating lung infections.
For me, this unit, it's changed my life. It just makes me just feel so valued and just so proud that I belong somewhere. And I just feel that my health is just, well, I like to think it's getting better. Yes. Yeah.
Well, you look amazing.
Thank you.
It's wonderful to see how great care combined with a fantastic environment is having such a positive impact. In the Children's Cancer and Neurosciences ward, the charity has helped transform the space. They have created an environment that really is helping children and their families cope with having such a serious illness.
For many families, they have to spend upwards of a month at a time in the hospital. And having an environment that is cheerful, looks good, is actually hugely important in terms of their morale.
I think we would have been lost without a setting like this. I think most of the children are having really awful treatment. They're getting really sick, and I'm sure the environment, the facilities help enormously. They really do.
For me, what is particularly special about Nottingham Hospital's charity is that I was able to donate direct to the area that I felt most passionate about supporting. It mattered to me that the money I raised would go straight into research, which would look towards finding new treatments and approaches to care.
The charity have been really supportive. They understand the needs of the patients and the need that we need to fund research. You know, the research that I'm doing, it will shed light in areas that haven't been explored before.
The charity also supports staff to undertake specialist training to help improve their skills. Helen is a midwife who has had support from the charity to continue with her training.
So one of the things that I've done the RCN leadership programme. It kind of gave me the building blocks that I needed to be a good leader, really. Without the charity, I wouldn't be where I am now, and I just think everything that I do every day, actually that programme's helped to shape that.
I am so glad that people like Helen are receiving the support of the charity, because I know that when times are challenging, it is their passion, dedication and experience that makes all the difference to patients and their families. Just down the corridor is the neonatal unit that cares for newborn babies with health issues, particularly those born prematurely.
During our stay here, it was a very difficult time, but it was made a lot more bearable by the work of the hospital charities and the things they provided. And probably the most important thing was the camera that they used to take pictures. You know, it means a massive amount to us now, looking back, that we've still got those photographs.
John and Becky wanted to give something back to the hospital, so, like me, they became fundraisers for the charity.
I don't think there's anything that can express the words that we have to say what a big difference you make. You know, you may not think just by doing that run or by going for a coffee morning or doing a cake store or anything, it's not very much money to us and to our parents, to our families. It's the best.
I feel so privileged, the fact that somebody has actually donated that money so we can carry on this work. So thank you.